Hello everyone, my name is Fred Rojas. I'm going to be doing my presentation for Bio 231. Just a quick little disclaimer, viewer discretion is advised due to the images that will be showed. I chose to do my presentation on Anorexia Nervosa. Just a quick little note, I chose to do Anorexia Nervosa just because it's so popular amongst people my age, and I always hear about it in the news, social media, so I just want to learn more information about it and see what it's all about rather than just, people being really skinny. So what it is, it's an eating disorder causing people to obsess about weight and what they eat. Most people know it as anorexia is people who throw up right after a meal, or they vomit whatever they eat, and that is called purging. Anorexia is abnormally low body weight. Anorexia nervosa is referred to as just anorexia, but anorexia is a medical term. That means it's a physiological disorder. No, I'm sorry. Anorexia is a Latin word referring to loss of appetite and is a medical term used for mental and physical health. The nervosa part means that it's a physiological disorder. They're not necessarily the same thing, but I'm going to be just referring to it as anorexia. We're going to watch a quick little video about anorexia.
Nervosa or anorexia is very common in women. 95% of individuals diagnosed with anorexia are female. Anorexia is not about dieting or fear of obesity. It may start off that way, but what ends up happening is the woman becomes very focused on losing weight, so much so that there's an intense sense of neurochemical satisfaction in becoming more slim. In fact, the individual with anorexia doesn't even realize quite how small they're becoming. They have body dysmorphic issues, meaning that they cannot see the thin individual in the mirror. Once this individual starts to restrict their eating, other factors come into play. She may start to take diet pills or exercise excessively. She may take diuretics or even enemas to continue the weight loss. Anorexia nervosa is very serious and beyond therapeutic intervention typically requires medication and medical interventions as well. While anorexia nervosa is a very serious eating disorder, it has many psychological factors that are important to understand. But these are some of the basic and most important components of understanding anorexia.
These are some of the signs and symptoms. According to the Mayo Clinic, there's two types of symptoms. There's physical and then emotional. We're going to do the physical first. The most obvious is extreme weight loss. You will see that anorexic people are extremely skinny. You could often see how their bones, their rib cages, you could just tell right away. Some other signs are fatigue, insomnia, dizziness, the hair standing out, dry or yellowish skins, dehydration, low blood pressures, swelling of the arms, etc. On the other side, we have emotional and behavior symptoms. The behavioral symptoms are restricting food intake, excessively exercising, binging, and self-induced vomiting, known as purging. The emotional symptoms are a lot, such as preoccupation with food, which sometimes include cooking elaborate meals for others, not eating them yourself, skipping meals, denial of hunger, not wanting to eat in public, lying about how much food you ate, etc. Just being in denial. These are just quick little pictures to show about the signs and symptoms. Trying to look as skinny as you can, then maintaining your health, fear of gaining weight, developing rituals regarding foods, mood swings for the behavioral, picky eating, physical signs, the weight fluctuation, constipation, etc. The causes of anorexia. According to WebMD, the exact causes of anorexia are unknown. As for genetics, it's not necessarily a genetical factor, but it is very influential. For example, if it runs in the family, let's say your mom, brother, or sister had it, it's gonna be influential on yourself that you might develop it as well. I would say the what I found out most interesting to me that it's more of a social cause, such as so for example, let's say you do ballet, you're gonna notice that most of the ballet dancers are very skinny, small, petite. That's gonna make you want to be like them because they get all the attention, they're so pretty, etc., etc. Which is why I say it's a social cause. Bullying may lead to that. At school, people may think, "Oh, you're fat, so you're gonna be all wanting to lose weight and be all skinny." You see all over TV and social media. You see all the celebrities are so skinny and everything, so you want to be skinny like them. Friends might peer pressure you at school. Your friends might bully you, etc. It's more of an influential cause, not necessarily genetic. The pathophysiology of anorexia nervosa. It has a lot of endocrine abnormalities, such as low levels of gonadal hormones, thyroid abnormalities, increased cortisol secretion. This is a quick little excerpt I found from a website that talks about the pathophysiology of anorexia, such as dehydration, metabolic alkalosis, cardiac muscle mass change, chamber size, etc. This is a continued. Some other research suggests that patients with anorexia nervosa have altered brain function and structure. There are deficits in neurotransmitter dopamine, differential activation of the cortical limbic system, which is the appetite and fear. Patients have comorbid psychiatric disorders such as major depressive disorder and generalized anxiety disorder. Since this is not just a physical disease, it's also psychological. It leads to a lot of depression and anxiety. This is some of the complications caused by anorexia, according to the Mayo Clinic. Since it is a eating disorder, you're not getting the foods that you need to maintain a healthy lifestyle. So it can lead to anemia, heart problems, loss of muscle, bone loss in women's, absence of a period cycle, in males decreased testosterone, electrolyte abnormalities like low blood sodium, potassium, kidney problems. Those are all physical side. And on the psychological sides, it can lead to depression, like I mentioned before, anxiety, obsessive compulsive disorders, alcohol and drug disorders, issue, and very importantly, and not to be left behind, self-injury such as suicide. One way to diagnose, there are multiple ways to diagnose anorexia, but most of it is self-explanatory. It's physical and you could just tell. And the most one is weight loss, with the obvious sign. And this also, if you feel that you have fear of getting fat, turning away too much food, denying that you're hungry, not eating, If you notice hair loss, the thinning loss, like I mentioned in the very beginning, tooth decay, fatigue easily, and that you're vomiting or developing enemas. Now, once the doctor, if you decide to get checked out by a doctor, and they find these symptoms on my left, right here, they're going to run exams on you. And those exams are going to be physicals, so they're going to start with your height and weight and check your vital signs. After that, the doctor might send you to get some blood work to get a complete blood count, the CBC, which is the purple top tube that has EDTA. I ran a bunch of these at the hospitals when doing my clinicals. They check for everything in the blood. One of the most important tests that they run, the phlebotomists run. After they run blood work, the doctor might send you to get some psychological tests, which is with the professional. So I sit down conversations to talk about how you're feeling, if you're eating well, and all that. And then on the side, depending on how bad your situation is, a doctor may have you get some X-rays to check out your bone density, check if they're doing, how good or bad they're doing, and they also might have you get an ECG to check to monitor how the heart is doing, because you're not getting all those nutritions from the foods. Now, how to manage anorexia. The most important part of managing anorexia is admitting that you need help. Most people deny it, so that's the hard part, is to accept it. From the professional standpoint, the doctors may have you hospitalized depending how bad the condition is. Since it's an eating disorder, you're going to be dehydrated. You can have an electrolyte imbalance. And if you're not hospitalized, you might need professional care, such as someone checking your vital signs often. And if you're not eating properly, or you can't digest the food properly, you might need a nasogastric feeding tube, which is pictured right here. And probably the most common way is psychotherapy. You talk to someone about it, talk about your feelings, how you're dealing with the problem at home, or you need what helps best. And since I keep mentioning it is a psychological problem, so there's no medications exactly to stop anorexia, but since it's a psychological problem, doctors might recommend antidepressants to help with the anxiety that it comes with, or the depression that it may come with. Prognosis of anorexia. Let's talk about the remission. 3/4 of patients treated in outpatient settings remit within 5 years, and the same percentage experience intermediate good outcomes, such as gaining the weight back. Relapse is common in patients who are older rather than younger. Patients who achieve partial remission often develop another form of eating disorder, such as bulimia. Morbidity rates range from 10 to 20%, with only 50% of patients making a complete recovery, and then the remaining 50%, 20, remain emaciated, and the remaining 25% remain thin. The mortality, anorexia has the highest mortality of all the eating disorders, since you're starving to death basically. 10% of the people affected per decade die due to unrecognized diseases. Due to anorexia being a psychological disease, 25% of deaths are due to suicide. The epidemiology of anorexia. Anorexia is more common in females than males. Mostly common in the age group of 15 to 19-year-olds. Out of all the eating disorders, like I mentioned, anorexia has the highest mortality rate. Risk factors for eating disorders include childhood obesity, female sex, mood disorder, personality traits, sexual abuse, or weight-related concern from family or peer environments. Um, these are just little quick stats about the prevalence. Um, this is a little bit different from this side. This one on the left is more updated. Now, the history of anorexia. Textbooks and articles based on my Google search have no direct founder of anorexia, but it's between British physician William Withy Gould or the French neuropsychiatrist Ernest Charles Lesage. Gould is given the upper hand just because he mentions anorexia, an anorexia-like condition, in a paper that he wrote in 1873. But Ernest, he talked about anorexia in one of his articles as well, so there's no direct winner. The first time anorexia was diagnosed in a patient was in 1689. That's a 200-year difference between the both. So it's a little iffy. I don't know why Richard Morton is not credited, but Gould is. Richard described it as a case of nervous conception. It was one in a boy and one in a girl. This is considered one of the earliest cases of anorexia. The cases of the illness we now know as anorexia. This picture right here of the girl is known as Miss A. She is turned to be the first person with anorexia. There's different types of eating disorders. When I was researching, I found out that anorexia and bulimia are not the same thing. Anorexia is more of starvation, and bulimia is when you're at a normal weight, but you think you're not, or when you're, so for example, like the picture shows right here, you think you're fat, but you're really, really skinny, so you're going to keep starving yourself. Bulimia is scared to be gaining weight, so you keep throwing up, purging after eating certain meals. These are some celebrities with the eating disorder, with eating disorders. There's this Lady Gaga. She runs a foundation called Born This Way that helps kids with eating disorders after she came out with anorexia. She speaks out about it often. Taylor Swift, she used to not eat well properly. I read an article saying that she used to feel like she was going to pass out after doing the end of a show, but she thought it was normal. Then she finally realized, no, I have to eat food to feel better. So she had an eating disorder. She finally came out about it. Demi Lovato, probably one of the most popular celebrities that speaks out about an eating disorder. And she recently had a documentary on YouTube that talks about her time with drugs and her suicide attempts and all that. She suffered from anorexia and bulimia, so she's a very popular figure for the generation nowadays. Now, Elton John, he just often speaks out about his struggles with drugs, bulimia, and his eating disorders. Lastly, as we come to the end of my presentation, these are just some hotlines to help anyone who sees this or may see this that's suffering with a eating disorder, not just anorexia, bulimia, or any of those. The United States, the United Kingdom, Australia, and Canada. That's just my presentation. I hope you enjoyed it, Professor. Thank you.